So we're looking at moisture control or tooth isolation. And as the name suggests, we want to effectively isolate the tooth or the site that we're working on, it could be multiple teeth, from the moisture that's contained in the mouth and the breath. So, as with every session, we begin by checking in with the subject's intended learning outcomes, just to be very clear that we're sure about the intended learning outcomes and that they're made clear to you. So these are our subject intended learning outcomes. So just again a moment to just locate yourself where you think the tooth isolation elements would fit here. And so very clearly they fit with the last two of our learning outcomes. So identify and select materials and medicaments, to perform basic dental procedures. So whilst tooth isolation in itself is not a treatment, it is a procedure that we would apply prior to commencing treatment. And it's also part of the next one down, which is you being able to perform basic dental procedures in a simulated clinical environment. So you will be asked to demonstrate the skills of tooth isolation in the simulation lab. So this is clearly where we're working today. In terms of the subjects though, and in terms, the session, for this particular session, we are focusing in on these more specific intended learning outcomes. So by the end of your experience, so including the face-to-face class, the online lesson, and the prac classes, you should be able to describe the rationale for moisture control / tooth isolation procedures in dental care. So what is a rationale? It's a reason or group of reasons for doing a particular thing. So you need to describe why we would use these particular procedures in dental care. What is the rationale? Secondly, we're identifying and then explaining the commonly used techniques for moisture control / tooth isolation. So you need to be able to identify what the different techniques are and then explain each of those techniques. The next one is to compare and contrast the benefits and limitations of the common moisture control or tooth isolation techniques in dental care. So those that we commonly use in dental care, you need to firstly identify them, and then you need to consider, by comparison and contrasting, the benefits of each of those. So each technique, what are their benefits? So comparing and contrasting them, and then the limitations. Again, comparing and contrasting across the different types of moisture control. Once you've got that under your belt, the next task is to identify and select materials and equipment. And this intended learning outcome is very similar to one of the subject level intending outcomes, which is around identifying and selecting. So you'll need to identify and select the materials that you need in order to use one technique, rubber dam tooth isolation. And then finally, an application of all of that understanding is that you'll be asked to apply rubber dam in a safe manner in a simulated mouth. So they're the session intended learning outcomes. So when we look at rubber dam as an isolation technique, and I've talked in other short videos about the two most common forms of tooth isolation, the cotton roll isolation form and the rubber dam. When we look at the rubber dam, a lot of people think it's a relatively new thing. And in fact, you might think, I've never seen this before, and many of your patients may also say, I've never had this done before, is this a new thing? Well, in fact, it's been around for some time. So Dr. Barnum in 1864, Dr. Barnum is probably the person that we would locate the development of the use of rubber dam with. So 1864, that was a long time ago. But he said at the time, it's hard to believe that a sheet of rubber can make you feel comfortable about dental treatment and allows us to do better dentistry. But Rubber Dam can. So what he's saying here is that it has benefits for both the patient, and he's identifying this as comfort, and also for us as the operators, because it means that we can do better dentistry for the patients. So in 1864, he identified the Rubber Dam as contributing to both patient comfort and also the quality of care that we provide. This is his gravestone, so if you want to make a pilgrimage to the gravestone or the final resting site of Dr. Barnum, you can do that in the United States. Now, at around the same time, Dr. White introduced the Rubber Dam punch. So the Rubber Dam was introduced as a barrier that could be used to stretch over the teeth to isolate the tooth from the mouth. A little bit later, someone said, well, we need an effective way to put holes in the dam without tearing the dam, and so Dr. White created this Rubber Dam punch, and you'll be using this Rubber Dam punch, which is very, very similar to the one that Dr. White introduced some time ago. You'll be using that to punch holes in the dam. And then at around the same time, there were these devices called Rubber Dam clamps, and the clamps were developed to hold the Rubber Dam sheet in place on the tooth. So the clamp, as the name suggests, is a device which clamps to the tooth and secures in place the Rubber Dam. So these tools or pieces of equipment you will be using in 2018 to isolate teeth. Now, these are some scary looking pictures. These are probably from around the time that Rubber Dam was first introduced. And you can see that there are some devices here made of leather with some sterling silver buttons and clamps to hold them in place. And there are all sorts of devices that were developed to hold the Rubber Dam in place. You can see that it's a little bit cumbersome, a little bit clumsy, and from our knowledge now of infection control and prevention in the dental surgery, you can see that these leather devices may not be the most appropriate to use in modern dentistry. So the clamps, the punch and the Rubber Dam are sort of the same, but we've moved on in terms of the techniques for placing the dam and maintaining it in the mouth. Here is a picture of a dentist at around the same time, and you can see the patient in the chair actually has one of those devices strapped to their head. We need to make this procedure as comfortable as possible for the patient. Patient comfort was not probably something that was considered to be of ultimate importance back then, but now it's something that's increasingly important for us. So it's important that we were able to place the dam as easily and as comfortably as possible, and to keep it in place there while we're working. So this is how it looks today. You can see the Rubber Dam here in place. You can see the clamp on the tooth itself holding the dam in place, and this device here, which is actually just holding the dam out for us so it doesn't sort of fold in on the operating side, that is called the Rubber Dam frame. So this is the modern setup, and this is how the dam will look when you place it. One thing I have to say about Rubber Dam, however, and we'll talk about this in our face-to-face class in great detail, Rubber Dam is something that is routinely recommended, but it's something that is routinely not done in dentistry. For some reason, dentists and other dental practitioners don't utilize Rubber Dam as much as the evidence suggests that they should. And in 1962, Ireland said this: "No other technique, treatment or instrument in dentistry is so universally advocated by recognised authorities and so universally ignored by the practicing dentist." Unfortunately, we still see this scenario today. So my question to you is, why aren't dentists using rubber dam as an isolation technique when there seems to be a great deal of evidence for its use? Now, one thing that I hear commonly in the real world of dentistry, and I see this myself in clinical practice, is that many people don't use it, and they say things like, when you ask them why they're not using it, it's not really required, it's not really necessary, it's a little bit over the top, and it's something that they teach you at dental school but is not really required. Now, my question to them is, given that university curriculum is so crowded, there's so much to teach students in such a small period of time, given that teaching in dentistry is expensive, given that we are evidence-based at universities in terms of our research but also our teaching, why would the university invest time and money teaching you and insisting that you use this particular tooth isolation procedure if it is not useful? I cannot understand why we would do it, why would we spend so much time insisting that it's used in your clinical placements if it is not at all useful. I'll leave you to ponder that, because you will come across scenarios in the clinic where you will recognise that this is a clinical scenario where rubber dam is recommended, and in some cases there are statements that it is mandatory, and yet clinicians are choosing not to use it. We'll talk more about this in the face-to-face.